Welcome to Understanding Therapeutics with Virtual Homeopathy. In today's session, I will be talking about Kali Iod, the respiratory system, the respiratory complaints of Kali Iod. There are mainly two main respiratory complaints I'll be talking today. One is allergic rhinitis. In Kali Iod, you will find all the classical symptoms of allergic rhinitis. The patient will have sneezing with lots of nasal discharge. Lots of coryza will be there. The character of the nasal discharges, it is acrid and it is watery. So there is acrid watery coryza in Kali Iod. There will be lots of lacrimation also. The patient will, you will find that the nose is red and swollen, the eyes are red, the face is red. So here you see that all the classical symptoms of allergic rhinitis are present. There is sneezing with lots of acrid and watery coryza with lots of lacrimation. The eyes, face, nose, all of that are red and swollen. Now let's look at what causes these complaints. Now exposure to cold precipitates these allergic rhinitis symptoms in Kali Iod patients. Whether it is cold air, cold room or traveling in cold air, all that will cause complaints in Kali Iod. Now let's look at the modalities. Now the patient wants open air. You see that the complaints are caused after traveling in cold air, but they cannot tolerate warmth. They want open air. They would like to walk in open air. So they cannot, Kali Iod patients cannot tolerate warmth. Now the acrid watery coryza will disappear and in its place will come the yellowish green discharge from the nose. Now this discharge is offensive and it is non-irritating. The watery coryza was irritating, it was acrid, but the yellowish green discharge is non-irritating. The patient will also have headache. Now in Kali Iod there is involvement of sinuses, especially the frontal sinuses are involved in Kali Iod. So you will find headache with yellowish green discharge which is offensive. Now next condition for which you can give Kali Iod is pneumonia. Pneumonia is the first was the allergic rhinitis, now it is pneumonia. In pneumonia you have to look for the features of cough and for the features of fever in Kali Iod. Now when you look at the cough with the cough again there will be greenish expectoration. The cough will be worse in the morning. When the patient wakes up, even before waking up, they will be coughing with greenish expectoration and again they cannot tolerate warmth. They don't like warm room, they don't like closed room, they don't like warmth at all. There will also be chest pain when the patient is coughing. Now if you look at the fever, with the fever there is headache, patient is thirsty, there is thirst in Kali Iod, there is redness of face, nose and eyes. So headache with thirst with redness of face, nose and eyes. That is what you will find in Kali Iod fever. So in pneumonia you have to look for the cough complaints and for the fever. Again during this stage with the cough and fever the patient cannot tolerate warmth. They want open air. Now if you like this video, share it with your friends and subscribe to this channel. You can also follow me on Instagram where I share clinical tips, short clinical tips regularly.